Medicare's Inpatient Rehabilitation Facility, Prospective Payment System or IRF PPS, standardizes payments for intensive rehabilitation services. It significantly influences a facility's financial stability and operational planning. Understanding IRF PPS is essential for staff to ensure accurate reimbursement. The system operates as a case-based payment model, incentivizing efficiency and effective care outcomes. Facilities receive payment per patient discharge, encouraging wise resource management. This guide is for rehabilitation professionals, billing teams, and administrative staff. For clinicians, it informs care planning. For billing teams, it ensures accurate claim submission. Administrators rely on this understanding for budgeting and strategic growth. A shared knowledge base fosters better internal communication and financial health. This essay will delve into the specific mechanics of the IRF PPS. Let's explore how this system works. Case mix groups, or CMGs, are the cornerstone of IRF PPS payment calculation. CMGs classify patients based on clinical characteristics and expected resource needs. Derived from comprehensive patient assessment data, CMGs ensure payments align with care costs. The IRF Patient Assessment Instrument (IRF PAI) is crucial for CMG determination. Clinicians complete the IRF PAI for every Medicare patient, capturing diagnosis, comorbidities, and functional status. Accuracy in completing the IRF PAI is paramount for correct payment. CMS defines numerous CMGs, each with a relative weight reflecting average resource use. Higher-weighted CMGs result in higher base reimbursement rates. CMS recalibrates these weights annually to reflect current treatment practices and costs. Understanding these weights helps facilities anticipate reimbursement. For example, a stroke patient might be assigned a specific CMG based on impairment level and age. Another patient with a hip fracture would likely have different functional scores and a different CMG. CMG assignment directly influences the initial base payment amount. This foundational step is critical for the entire payment process. Accurate CMG assignment ensures fair and appropriate reimbursement. Let's move on to other factors influencing payment. Next, we'll discuss comorbidities, wages, and facility specifics. The IRF PPS includes adjustments for comorbidities, refining payments further. Comorbidities are additional conditions that increase care complexity and cost. Accurate documentation of comorbidities is crucial for appropriate payment adjustments. The IRF PI records these conditions, determining if a patient qualifies for a comorbidity tier. This tier refines the payment calculation, acknowledging different medical needs. Another significant adjustment is the wage index, accounting for geographic labor cost differences. The wage index adjusts the labor-related portion of the national base payment rate. Facilities in high-wage areas receive higher payments, while those in lower-wage areas receive adjusted payments. CMS updates wage index values annually based on hospital wage data. Facility-level adjustments apply to IRFs meeting specific criteria, like serving low-income patients or being in rural areas. Teaching hospitals may also receive adjustments for training medical residents. These adjustments acknowledge unique provider characteristics impacting operational costs. For instance, rural facilities might face challenges in recruiting specialized staff. Teaching hospitals often treat more severe cases. These adjustments ensure fair compensation for facilities with unique challenges. Understanding these factors is essential for accurate reimbursement. Next, we'll explore the outlier factor and a simplified payment glimpse. The IRF PPS includes outlier payments for exceptionally high-cost cases. These payments provide a financial safety net for IRFs facing substantial costs. To qualify, a case must exceed a specific cost threshold. The threshold is calculated by adding the standard IRF PPS payment to a fixed loss amount. Facilities must meticulously document these high costs. If approved, outlier payments cover a percentage of costs above the threshold. This mechanism helps maintain access to care for high-cost cases. Let's consider a simplified payment example. Imagine an IRF admits a patient assigned to a CMG with a base rate of $15,000. The patient has comorbidities qualifying for a Tier 2 adjustment, adding $1,000. The initial case mix adjusted payment is now $16,000. The wage index for the facility's location is applied to the labor-related portion. If the labor portion is 70% and the wage index is 1.1, this part is adjusted upwards. The non-labor portion is not adjusted by the wage index. This example shows how components build up. Understanding the payment calculation flow is vital for IRF staff. Let's move on to the importance of documentation and staying current. Accurate documentation is the cornerstone of the IRF PPS. Every payment calculation element relies on data recorded in the IRF PII. Inaccurate documentation can lead to incorrect CMG assignment and missed adjustments. Consistent, detailed medical records are essential for proper payment. Timely submission of IRF PII data is critical for compliance. CMS has strict deadlines for transmitting assessment data. Failure to meet these deadlines can result in payment reductions or penalties. Efficient internal processes ensure timely completion and submission of the IRF PII. Regular internal audits can identify and correct potential bottlenecks. Compliance extends beyond the IRF PII to all Medicare rules and regulations. Facilities must stay informed about ongoing changes affecting coverage, coding, and audit priorities. Non-compliance can lead to payment recoupments, fines, or exclusion from Medicare. Ongoing staff training and education are crucial for maintaining compliance. A comprehensive understanding of the IRF PPS ensures appropriate reimbursement. This supports financial stability and high-quality care. Rehabilitation professionals should actively seek updates from CMS. Mastering the IRF PPS is an ongoing journey of learning and adaptation.